If you're over 50 and dealing with a weak urine stream, constant urgency, or waking up multiple times at night, you're not alone. Millions of men suffer from enlarged prostate symptoms that disrupt their daily lives and rob them of quality sleep. The frustration of incomplete bladder emptying and the embarrassment of frequent bathroom trips can make you feel like your body is failing you. Most men think prescription medications are their only option, but today I'm going to show you something different. What if I told you that simple movements you can do right in your living room could help alleviate these troublesome symptoms? These aren't complicated gym exercises or expensive equipment routines, but basic movements that improve blood flow to your pelvic region. The key is understanding that your prostate health is directly connected to circulation, muscle strength, and tension in your pelvic area. When you address these factors naturally, you can experience real relief. I'm going to share 5 specific exercises that take less than 10 minutes total and require absolutely no special equipment. These movements target the exact muscle groups and circulation patterns that support healthy prostate function. Each exercise has been chosen because it addresses a specific aspect of prostate health, from improving blood flow to strengthening supportive muscles. You can do these in your pajamas, in your bedroom, or wherever you feel comfortable. My name is Dr. Isabel Lopez, and I specialize in men's health with over 15 years of experience helping men reclaim their comfort and confidence. I want to know where you're watching from today, so please comment your city below and let me know you're here. Make sure to follow this channel because I share practical health solutions like this every week. Now let's start with the first exercise that you can begin doing immediately after this video. The first exercise is called stationary marching, and it's incredibly simple yet powerful for prostate health. You're going to stand in place and march as if you're walking rapidly, but without moving forward. Lift your knees up toward your chest with each step, bringing them as high as comfortable. Keep your arms moving naturally as if you're taking a brisk walk through your neighborhood. Do this for 2 to 3 minutes continuously, maintaining a pace that feels energizing but not exhausting. You should feel your heart rate increase slightly and your breathing become a bit deeper. If you need to take a brief rest, that's perfectly fine. Just resume the movement. The goal is to get your blood pumping and your pelvic region warming up. This simple movement dramatically improves circulation throughout your entire pelvic area, including the tissues surrounding your prostate. Better blood flow means more oxygen and nutrients reaching your prostate, which helps reduce inflammation and swelling. The rhythmic lifting of your legs also engages your core muscles and stimulates the muscles of your pelvic floor. This gentle activation helps improve the coordination between your bladder and the muscles that control urination. Many of my patients notice that after just 1 week of daily stationary marching, their urine stream becomes stronger. The improved circulation also helps reduce that feeling of incomplete bladder emptying that so many men experience. But this is just the beginning, because the second exercise we're about to cover specifically targets the muscles that directly support your prostate. This next movement might look simple, but it's incredibly effective at strengthening your entire pelvic region. The pelvic bridge is one of the most effective exercises for prostate health because it directly strengthens the muscles that support your entire pelvic region. Start by lying on your back on a carpet or yoga mat with your knees bent and feet flat on the floor. Your feet should be about hip-width apart, and your arms should rest comfortably at your sides. Take a moment to relax and focus on your breathing before we begin the movement. Now slowly lift your hips up toward the ceiling, creating a straight line from your knees to your shoulders. You should feel the muscles in your glutes and lower back engaging as you lift. Hold this position for 2 to 3 seconds, really focusing on squeezing your glute muscles at the top. Then slowly lower your hips back down to the starting position with control. Stick with me until the end of this video because the final exercise I'm going to show you is the most important one for urinary control. Perform 10 repetitions of the pelvic bridge, rest for 30 seconds, then do another set of 10. If 10 repetitions feel too challenging at first, start with 5 and gradually build up your strength. The key is maintaining proper form rather than rushing through the movement. This exercise strengthens your glutes, your core muscles, and most importantly, it activates your pelvic floor muscles. These are the same muscles that help control urination and support your prostate from below. Stronger pelvic floor muscles mean better bladder control and reduce symptoms of prostate enlargement. The bridge also helps improve posture, which reduces pressure on your pelvic organs throughout the day. Our third exercise takes a completely different approach by focusing on flexibility and reducing tension in the hip area. The butterfly stretch is essential for prostate health because tight hip muscles can create additional pressure around your pelvic organs. Sit comfortably on the floor or on the edge of your bed with your back straight. Bring the soles of your feet together in front of you, letting your knees fall naturally to the sides. Your feet should be positioned about 6 to 8 inches away from your body, close enough to feel a gentle stretch. Place your hands on your ankles or feet, and gently pull your heels slightly closer to your body. You should feel a comfortable stretch in your inner thighs and hip area, but nothing painful or intense. Keep your back straight and your shoulders relaxed as you hold this position. Breathe normally and allow your muscles to gradually relax into the stretch. Hold this position for 20 seconds, focusing on breathing deeply and allowing your hip muscles to release tension. After 20 seconds, release the stretch and shake out your legs gently. Repeat this stretch 3 times total, with a brief rest between each repetition. Tight hip flexors and inner thigh muscles can contribute to pelvic congestion, which worsens prostate symptoms. By regularly stretching these areas, you're creating more space and reducing compression around your prostate gland. This improved flexibility also enhances blood flow to the entire pelvic region and can help reduce the urgency and frequency of urination. The fourth exercise we're about to explore might surprise you because it focuses on something most men never think about in relation to prostate health. Most men don't realize that stress and shallow breathing can actually worsen prostate symptoms by creating tension in the pelvic muscles. When you're stressed or breathing poorly, the muscles around your prostate contract and can increase pressure on the gland. Deep diaphragmatic breathing is a powerful tool that helps relax these muscles and improve overall pelvic health. This exercise can be done sitting in a comfortable chair or lying down on your back. Place one hand on your chest and the other on your abdomen, just below your rib cage. When you breathe correctly, the hand on your abdomen should move more than the hand on your chest. Take a slow, deep breath through your nose, allowing your abdomen to expand like a balloon filling with air. Your chest should remain relatively still while your belly rises. Exhale slowly through your mouth, allowing your abdomen to fall naturally as the air leaves your lungs. Make your exhale longer than your inhale, which helps activate your body's relaxation response. Focus on making each breath smooth and controlled, without forcing or straining. Practice 10 deep breaths like this, taking your time with each one. You might notice that you feel more relaxed and that tension in your pelvic area begins to release. This type of breathing reduces stress hormones that can contribute to prostate inflammation and helps improve blood flow throughout your pelvic region. Regular practice of deep breathing can help reduce the frequency of nighttime urination by calming your nervous system. Now we're ready for the most important exercise of all, one that directly strengthens the muscles responsible for urinary control. The male Kegel exercise is perhaps the most important movement you can learn for prostate health and urinary control. These are the same muscles you would use to stop your urine stream midway or to prevent passing gas in public. Many men have never consciously exercised these muscles, but they are crucial for maintaining bladder control and supporting prostate function. The beauty of Kegel exercises is that you can do them anywhere without anyone knowing. To find the right muscles, imagine you're trying to stop your urine stream or prevent gas from escaping. You should feel a lifting sensation in your pelvic area, but avoid tensing your buttocks, thighs, or abdominal muscles. The movement should be isolated to your pelvic floor muscles only. If you're having trouble identifying these muscles, try stopping your urine stream next time you're in the bathroom to get familiar with the sensation. Once you've identified the correct muscles, contract them and hold for 5 seconds, then relax for 5 seconds. Start with 10 repetitions and gradually work up to holding for 10 seconds if possible. Perform this exercise 2 to 3 times throughout your day, perhaps when you wake up, after lunch, and before bed. Consistent Kegel exercises can dramatically improve urinary control, reduce post-urination dripping, and strengthen the muscles that support your prostate. Many men notice improvements in their symptoms within just 2 to 3 weeks of regular practice. These exercises also improve blood flow to the prostate and can help reduce the size of an enlarged prostate over time. The strengthened pelvic floor muscles provide better support for all your pelvic organs, leading to improved overall function. Join the Members Club and drop a super like on this video if you're ready to take control of your prostate health naturally. These 5 simple exercises we've covered today can make a real difference in your symptoms when practiced consistently. The stationary march improves circulation. The pelvic bridge strengthens supporting muscles. The butterfly stretch reduces tension. Deep breathing calms the nervous system. And Kegel exercises directly improve urinary control. Together, they create a comprehensive approach to prostate wellness that requires no gym membership or expensive equipment. The key to success with these exercises is consistency rather than intensity. Spending just 10 minutes each day on these movements can lead to noticeable improvements in your symptoms within 2 to 4 weeks. Many of my patients report sleeping through the night more often, having a stronger urine stream, and feeling more confident about their bladder control. Remember that these exercises work best when combined with other healthy lifestyle choices like staying hydrated, eating a balanced diet, and managing stress. Your prostate health doesn't have to decline with age, and you don't have to accept worsening symptoms as inevitable. These natural approaches work because they address the root causes of prostate problems rather than just masking symptoms. By improving circulation, strengthening supportive muscles, and reducing tension in your pelvic area, you're giving your prostate the best environment to function properly. Your prostate responds to what you do every single day, and with these simple exercises, you can have more control, more comfort, and better overall health. Start with just 1 or 2 of these exercises today, and gradually add the others as they become part of your routine. Small, consistent actions lead to significant improvements, and your future self will thank you for taking these steps toward better prostate health right now.